Did you know? Between 2000 and 2015, the global maternal mortality ratio declined by 37% to an estimated ratio of 216 per 100,000 live births. Almost all maternal deaths occur in low resource settings and can be prevented. Preventing unintended pregnancy and reducing teenage pregnancies through universal access to sexual and reproductive healthcare services are critical to further advances in the health of women, children and adolescents. Unhealthy environmental conditions increase the risk of infectious diseases, which is reflected in the strong integrated nature of the goals. In 2012, an estimated 889,000 people died from infectious diseases caused largely by fecal contamination of water and soil and by inadequate hand washing facilities and practices. In 2012, household and ambient air pollution resulted in some 6.5 million deaths. Mental disorders occur in all regions and cultures. The most common are anxiety and depression, which not infrequently can lead to suicide. In 2012, an estimated 800,000 people worldwide committed suicide, and 86% of them were under the age of 70. Globally, suicide is the second leading cause of death amongst those between the ages of 15 and 29. Around 1.25 million people died from road traffic injuries in 2013. Halving the number of global deaths and injuries from road traffic accidents by 2020 is an ambitious goal given the dramatic increase in the number of vehicles, which nearly doubled between 2000 and 2013. Hello and welcome to the video on SDG3, ensuring healthy lives and promoting well-being at all ages. While SDG3 refers to healthy lives and well-being, we can see that there are many issues worldwide, including those in relation to reproductive health, the health of maternal, newborn and children, disease and mental health, which are all dependent on health systems and funding. Health and sustainable development is based on the premise that human beings are entitled to a healthy and productive life in harmony with nature. It further recognises that the goals of sustainable development can only be achieved in the absence of a high prevalence of debilitating diseases, whilst recognising that health gains for the whole population requires poverty eradication. In this video, you will be given a broad overview of SDG3 and its associated targets. In the next section, we will present some examples of the Sport for Development project funded by the Australian Government. The targets related to this SDG seek to address some key areas, such as maternal and newborn mortality, HIV, tuberculosis, malaria, hepatitis B and waterborne diseases, cardiovascular disease, cancer, diabetes and chronic respiratory disease, suicide prevention and mental health, substance abuse, road traffic injuries, family planning, universal health coverage, hazardous chemicals and pollution, tobacco control, vaccines and medicine access, all the while strengthening the institutions, structures and workforces that deliver these outcomes. As part of the efforts to achieve the Maternal and Child Health Millennium Development Goals, or MDGs, the precursor to the SDGs, the UN Secretary-General Ban Ki-moon launched the Every Woman, Every Child initiative at the United Nations Summit in September 2010. Every Woman, Every Child is an unprecedented global movement that mobilises action by governments, the private sector and civil society to address the major health challenges facing women and children around the world. Preventing unintended pregnancies and reducing adolescent childbearing through universal access to sexual and reproductive health care is crucial to the health and well-being of women, children and adolescents. Globally, the adolescent birth rate amongst females aged 15 to 19 declined by 21% from 2000 to 2015. In Northern America and Southern Asia, it dropped by more than 50%. However, the adolescent birth rate remains high in 2/3 of all countries, with more than 20 births per 1,000 adolescent girls in 2015. Major advances have been made in combating infectious diseases. Globally, in 2015, there were 0.3 new HIV infections per 1,000 uninfected people. Among children under 15 years of age, there were 0.08 new HIV infections. That data represents a decline of 45% and 71% respectively since 2000. The incidence of HIV infection remained highest in sub-Saharan Africa, with 1.5 new infections per 1,000 uninfected people in 2015. A major risk factor for infectious diseases and mortality is the lack of safe water, sanitation and hygiene or wash services, which disproportionately affect sub-Saharan Africa and Central Southern Asia. Death rates owing to the lack of wash services in those two regions were 46 and 23 per 100,000 people respectively, compared to 12 per 100,000 people globally in 2012. Premature deaths before 70 years of age owing to cardiovascular disease, cancer, chronic respiratory disease or diabetes totalled about 13 million in 2015, accounting for 43% of all premature deaths globally. From 2000 to 2015, the risk of dying between 30 and 70 years of age from one of those four causes decreased from 23% to 19%, falling short of the rate required to meet the 2030 target of a 1/3 reduction. In 2013, about 1.25 million people died from road traffic injuries, the leading cause of death amongst males between 15 and 29 years of age. Road traffic deaths have increased by about 13% globally since 2000. Available data from 2000 to 2015 indicate that over 40% of all countries have less than one physician per 1,000 people, and around half have fewer than 3 nurses or midwives per 1,000 people. Almost all least developed countries have less than one physician and fewer than 3 nurses or midwives per 1,000 people.